Have you ever what it would be like to have fish or a lost jaw? So I'm sure you're wondering what I just said, and I said, have you ever imagined what it would be like to have face restrictions or complications in eating? All things like that from a locked jaw. Today, I want to inform you about 3 common jaw disorders. The first being the temporomandibular joint, also known as TMJ. There's a lot of disorders with that. Another one being bruxism and impacted wisdom teeth. So the first one we're going to look at is TMJ. It affects 12% of the U.S. population, and that comes from the Oral Facial Reconstruction and Implant Center. This is a sliding hinge that connects your jawbone to your skull. So if you put your hand right here and open your mouth, you can feel it working. TMJ can cause lockjaw in either the open or closed position. It can cause a locking or clicking sound. If you've ever known someone to have this and they're talking, you can actually hear it. To them, it can sound like grinding as well. The symptoms of this are pain, aching around the ear, just anything in that, not being able to open your jaw fully, not being able to close it completely. It can look like this, like this. This is caused by the disc eroding, the joint just being overused or not being in the right placement, and so it just does not work correctly, blocks your jaw in that place. Wrestlers have a lot of issues because impact to it can actually cause issues. And so you can imagine if they're getting punched in the face a lot, that joint is not going to work correctly. You can fix this by pain medication or muscle relaxers. Both of those are things that can help that joint move easier, give you less pain in your talking, eating, whatever you're doing. You can also get therapy. There's actually counseling and education on knowing the onset of when it's about to lock or when there's issues with that, so you can get counseling and do physical therapy on that and figure out exercises to help that. You can also get mouth guards or oral splints that will protect your mouth from opening too wide or doing things that can cause further damage. There's also a surgery called arthrocentesis. This is where a needle goes into that joint and pushes fluid through, because sometimes you can just get debris buildup in there, and that can cause further issues with that joint. So TMJ causes locked jaw. But the next one you're going to look up is one where you're gnashing your teeth, grinding them. It's called bruxism. This affects 50% of kids in their sleep, and that comes from the Sleep Foundation. So you can either have awake bruxism or sleep bruxism. So awake is when you're awake and you're doing this, and sleep is when you're sleeping. You unconsciously do this. It's not something people just do. It's something you're doing. Doctors don't know the exact cause of it. They think awake bruxism might be due to emotional response. And so imagine if you're mad, you're going to gnash your tooth, and you don't necessarily know that you're doing so. You're just doing that out of a coping mechanism from the reaction to the emotions. Or sometimes when people are nervous, they'll kind of grind their teeth a little bit. In their sleep, they think it's due to arousal in your sleep, but they aren't really for sure. Again, doctors are still studying this, still trying to figure out what's causing it. It affects kids more than adults. But you can also wear mouth guards to protect in your sleep, obviously, and splints as well. And you can get dental correction and reshape the chewing surface of your mouth. Finally, our last disorder causes intense pain in the back of your mouth, which you all probably know about this. It's impacted wisdom teeth. They're the third molars at the back of the mouth, and they don't have enough room to grow, and that comes from the Mayo Clinic. So many of you have probably had a surgery or heard of someone having a surgery to get these removed. And the teeth can be growing at an angle towards your other teeth and start moving all of your teeth. If you've had braces, you don't want that to happen because you have straight, pretty teeth. But it can grow towards the back of your mouth. It can actually grow under your other teeth. It can grow in a lot of different directions that cause issues in your mouth. You'll know if you have this. Your symptoms will be pain, your gums could swell up, you could have a bad taste in your mouth, and you could have bad breath from that, which no one wants. So to fix this, you can get them surgically removed. That's just a procedure we've heard of where you get those teeth removed, the third molars. But not everyone has to get these teeth removed. It's not something that everyone might have wisdom teeth. Some people might not, but the people who do have wisdom teeth, I have all mine still. My mouth is big enough to have them. Some people just have a smaller mouth, or they're growing in the wrong way. So you might not be able to, or you might not have to have that surgery if you have wisdom teeth. So today I have informed you about 3 common jaw disorders. one being temporomandibular joint, one being bruxism, and one being impacted wisdom teeth. Now, going back to my original question, I'm sure you've never imagined having these issues to stuck locked jaw, in the open or closed position, grinding your teeth. And some of you might have had wisdom teeth issues, but you don't imagine to ever have that pain. So remember how lucky you are not to have these issues in a day-to-day life problem.